Part 2. If concerns exist, a practical driving assessment may be conducted to observe the individual's performance in a real-world setting based on these evaluations. Licensing authorities might issue a standard license or restricted license with specific conditions. Or in rare cases of severe impairment, deny a license. Individuals should be transparent with their doctors and the relevant motor vehicle department about their condition to ensure appropriate evaluation and support. Failing to disclose a condition that affects driving ability can result in fines or legal consequences if an accident occurs. What is Tourette syndrome? Tourette syndrome is a neurological disorder that affects your brain and nerves. It causes you to make sudden movements or sounds called tics. Tics are involuntary, so you can't control or prevent them. Motor tics involve body movements, like eye blinking or shoulder shrugging. Vocal tics involve your voice, like sniffing or throat clearing. Motor tics tend to develop before vocal tics. Tourette syndrome, or Tourette's, usually starts in early childhood. Most of the time, tics become milder and occur less frequently in late adolescence and adulthood. Tourette syndrome is the most severe type of tic disorder. Tourette syndrome affects 1 out of every 1 per 60 children, which means that approximately 300,000 children in the US have the condition. Symptoms and causes. Symptoms of Tourette syndrome. The most common Tourette syndrome symptoms are motor and or vocal tics. Tics usually start between the ages of 5 and 7 and peak around age 12. Tics are either simple or complex. Simple tics. Simple tics are quick, repeated movements that only involve a few muscle groups. Shoulder shrugging and throat clearing are simple vocal tics. Complex tics. Complex tics involve many movements and muscle groups. Jumping and repeating certain words or phrases are complex vocal tics. Tourette syndrome causes. Researchers don't know the exact cause of Tourette syndrome, but the condition tends to run in families, so they believe genes may play a role. Issues with how your brain breaks down. Neurotransmitters may also contribute to Tourette syndrome. Neurotransmitters, like dopamine, are chemicals in your brain that regulate behavior and movement. Risk factors. Risk factors for Tourette syndrome may include sex. Males are 3 to 4 times more likely to develop Tourette syndrome. Biological family history. Parents may pass down Tourette syndrome to children through genes. Prenatal health. Children born to people who smoked or had health complications during pregnancy may be at a higher risk for Tourette syndrome. Low birth weight may also increase the chances of Tourette syndrome, as Tourette's occur with other health conditions. Most people with Tourette's have other health conditions. These are usually mental or behavioral health disorders, including diagnosis and tests. How doctors diagnose Tourette syndrome. To diagnose Tourette syndrome, a provider checks when the tics started. They should begin before age 18. Your child must have both motor and vocal tics for over a year. There isn't a blood test or imaging exam that can detect Tourette syndrome. Instead, your child's provider will carefully review their medical history and symptoms. Their provider may also do tests to rule out other conditions that could be causing tics. Management and treatment. Tourette syndrome treatment. Mild tics that don't affect your child's everyday activities might not need treatment. But severe tics can make it hard to function at work, school, or in social situations. Some tics can even lead to self-injury in these cases. Tourette syndrome treatment, including medication or behavioral therapy, may help. Tourette syndrome medication. For mild